Today's topic is the normal anatomical position. It includes planes, relations, comparison, and movements in our body. So, in the study of human anatomy for medical courses, the tool used to teach or learn is the anatomical position. Without normal anatomical position, what one medical professional speaks is not clearly understood by another medical professional. So you can see the normal anatomical position, wherein you can see the man, imagine a man is standing in front of you with erect posture, head is straight, and you can see the limbs hanging by the side, facing forwards, and the feet firm on the ground with toes facing forwards. So this is the anatomical position. So it is a concept. It is present in the subconscious mind of the medical professionals. For this, student has to imagine that a person is standing in front of him. He is standing erect with his feet firm on the ground. His toes are directed forwards. Head is straight. Eyes looking into infinity. Upper limbs hanging by the side of the trunk and with palms facing forwards. This is the position of human body which is in the mind of medical professionals irrespective of different positions in which the patient may be lying while being examined. So, the anatomical position does away all confusion among the medical persons and in understanding anatomy in a easy way. For example, let us take three structures, thyroid gland, sternum and aorta, and describe their anatomical relation to the heart. Then the sternum is anterior to the heart. Then thyroid gland is superior to the heart and aorta is posterior to the heart. Thus, anatomical position has brought precision in the understanding of relations among medical professionals. Then we go to planes. Planes are imaginary line passing through a man standing in anatomical position in front of a medical student or a professional. The planes help to study CT scan and MRI. There are three planes and they are sagittal, coronal and horizontal planes. You can see the pictures. That is the sagittal plane which cuts the body into right and left halves. Then coronal or frontal plane that divides the body into anterior part and posterior part, maybe unequal, and a horizontal plane which cuts across the body into upper and lower halves. So first we'll start with sagittal plane. First we have mid-sagittal plane. It is an imaginary line passing vertically through the human body, dividing the body into right and left equal halves. Then we have coronal plane, frontal plane. Coronal plane is an imaginary line passing vertically through the human body at right angles to the sagittal plane, and it divides the body into unequal anterior and posterior parts. Then we go to horizontal plane. The horizontal plane is an imaginary line passing across the human body at any place and divides the body into upper and lower unequal parts. So these are the planes. Then we go to terms of relation. Another aspect in the human anatomy study is relation study. Human body relations to one structure to another is learned, so that we have knowledge of anatomical relations. For example, a surgeon knows structures he encounters during the surgery because of anatomical relation. In a similar way, fusion explains structures that can be involved or compressed due to a tumor. Another, so the terms of relations. The terminology of relations consists of opposite terms like superior, opposite is inferior, anterior opposite posterior, superficial opposite is deep, proximal, distal, medial and lateral. So in the picture you can see the different terms, that is superior is towards the head and inferior is towards the feet. Then anterior is front, posterior is back. So coming to superior, we can say our eyes are superior to mouth and nose. And nose is inferior. Pelvis is inferior to thorax and abdomen. Anterior, toes are anterior to the foot. Posterior, the shoulder blade is posterior to the chest. Coming to superficial, skin is superficial to muscles and bone. Deep, the brain is deep to skull. Proximal, in our upper limb, the arm is proximal to forearm and hand. Distal, the fingers are distal to forearm and hand. Then other terms, that is medial. For example, the big toe is medial to other toes. Coming to lateral, the thumb is lateral in position to other fingers. Then comparisonal terms. The term ventral is similar to anterior. Similarly, dorsal is similar to posterior. When we apply the terms of relation to dog, for example, the meaning of anterior is different. In man, the anterior represents the front of man, as anterior surface makes the first presentation as one sees a person. In a dog, head is the first presentation. In man, the posterior is the back and is presented in the last. And in the dog, the last presentation is the tail. So that is the comparison of terms. Then we come to terms of movement. Movements occur at the joints. Movements can occur at three axes, and they are the transverse, anterior posterior and vertical axes. Flexion and extension. These movements take place in transverse axis. In flexion, the angle between two bones forming a joint is reduced. And in extension, the angle between the two bones forming the joint is increased. The example of flexion and extension is the elbow joint. Then abduction and adduction. These movements take place in anterior posterior axis. Abduction is a movement which is away from the body. The adduction is a movement towards the body. For example, in the movement of fingers away from and towards middle finger, that is both for abduction and adduction. Away is abduction, towards is adduction. Then we have medial rotation and lateral rotation. These movements take place in vertical axis. The movement which turns the anterior surface of body or upper limb medially is called medial rotation. And the movement which turns the anterior surface of the body or our upper limb laterally is called lateral rotation. The example is saying no with the head. Then circumduction. The play of four movements of flexion, extension, abduction, adduction is circumduction. The example of circumduction in our body is the wrist joint when wrist is rotated. Then we have one more term called as rotation. The play of six movements of flexion, extension, abduction, adduction, medial rotation and lateral rotation is called as rotation. The example of rotation movement is our shoulder joint, the ball and socket joint. Thank you.